Every lecture there's an important slide, and this is it. If you are going to take anything home today, I'd like you to memorize the slide and commit this to memory, because I am going to actually keep going back and forth with the slide. This is called a Caries Venn Diagram. This is not math, but we're going to talk about what causes cavities. And this is not just for baby teeth. This is for adult teeth. This is for you, for me, the babies. It could be for your grandparents. It doesn't matter how old you are. This is what the take-home message is, okay? To cause a cavity, you need teeth. If you don't have teeth, you can't get cavities. So option one, take all your teeth out. You don't have any cavities. But I don't think that's an option. So let's look at what else causes cavity. Sugar, refined carbohydrates. Now we all know about sugars and refined carbohydrates. This is candies and all that good stuff. But the other stuff is like, let's say, chips. You eat a packet of chips and it dissolves in your mouth, and as the enzymes are working on it, it breaks down into these carbohydrates. So that could also be a potential for cavities. Now, the next thing, so if you cut that out, then, you greatly increase your chance of not having cavities. So the next thing is plaque. Now, if you don't have bacteria in your mouth, that's great, because then you won't have any cavities, because that would be awesome. But the trick with bacteria is the moment you clean your teeth, brushing, flossing, the very second you do this, research has shown the immediate moment you get done walking out of your dentist's office, the very second your hygienist said, oh, your teeth are all clean, these things are growing immediately. So pretty much you don't even have time for that. It is immediate. So that is something that's really hard to control. It is in your mouth. It's just the nature of the beast. Just be aware of it. And the last thing is time. So if you have all four of these, teeth, sugar, refined carbohydrate, plaque, and you give it time, you put it all together and you just wait there, guess what's going to happen? You're going to get this in the center, which I wish I could have done it bigger, but it's caries, which is you get a cavity in your tooth. If you eliminate any of these factors, then you decrease that chance of getting a cavity. So for example, if you just have teeth and you have the bacteria on your teeth, but you haven't eaten anything, you haven't had any sugar, you haven't put anything in your mouth, and so that hasn't been in your mouth, and there's no time that that's been in your mouth, so there's no cavity there. Let's say you had teeth. You just, you brush your teeth, the bacterial count is really, really, really low. At that time, if you, ate candy, at that moment, your chance of getting a cavity is much lower because you don't have that many bugs on your teeth. At least that's the hope if you brush and floss really well. And again, the time factor, I think in dental school they said it takes 24 hours for a cavity to form. So that's pretty much one day for you. So if today, right now, if anyone's, eating a packet of chips or something and give it 24 hours, don't brush, don't floss, that's when it's going to start. Exactly one day. So this is the Caries Venn Diagram. If you can cut any of this, this is great. And I'm going to talk about this some more about, how to cheat with candy and stuff like that, because people ask me all the time, why, you're a dentist, you don't eat candy. That's not true. Dentists eat the most candies because we know how to cheat. And I love my candy too. So remember this, because we will come back to it. We'll go through this really fast. So this is what the whole lecture is about. Proper baby bottle usage, encouraging nutritional eating habits, scheduling the first visit, and of course, good oral home care. Okay, oral bacteria. How does your baby get infected? So you have this baby, alumni, everyone's happy. Wow, I got a baby. Well, how's the baby going to get the bacteria in their mouth? Well, it is transmitted mainly from mother or primary caregiver to infant. I have to say primary caregiver because these days a lot of people are taking care of the children. So sometimes children are left home with their grandparents, and the grandparents are taking care of the kids. So basically the bacteria is transmitted mouth to mouth. So from mother, primary caregiver to infant. Window of infectivity is first 2 years of life. First 2 years of life is where they get their entire flora. I mean, this is the time when you really want to cut down on that transmission. Okay. And so the earlier the child is colonized, as that means gets the bacteria, the higher the chance of getting cavities. And here you go. Mouth-to-mouth transmission takes place between a caregiver tasting or blowing on food before feeding babies. So caries it's an infectious disease. Now, let's say, like I have a cold right now. Who wants to share a bottle of water with me because I have a cold? Anybody? You do? Well, you shouldn't, because the reason none of you would want to share the bottle of water with me is because you're going to be like, oh my gosh, Dr. Amit, yeah, I'm going to get sick too. There's no way. So it is an infectious process, and it's the same way with the bacteria in your mouth. As you're feeding your babies, you taste it, and then here you got the bacteria on the spoon, and then you feed the baby, and that baby is going to get that same bacteria that's in your mouth. You blow on it. Sometimes when you blow on food, sometimes spit gets on it, and you feed the baby, and that's where the babies get their bacteria. So next time, think, if you want to share a glass of water or drink with someone who has a sickness, it's the same thing as far as, babies too. If you have a lot of cavities in your mouth, I would recommend you not feeding the babies after eating the same food. Okay, so basically, caregivers who reduce the amount of bacteria in their mouth can increase the odds that the babies will not inherit. So, if you as a caregiver can take care of your mouth, it's care for yourself first and then care for your baby. If you can care for yourself, make sure you're brushing, flossing, doing everything you can to cut that bacteria in your mouth down, then you are really helping your baby. And of course, you're helping yourself.